Hi, my name is Amy Toonstra, and I'm here to present my research work entitled Impact of High Intensity Inspiratory Muscle Training on Inspiratory Muscle Strength in Healthy Adults, a randomized controlled trial. And I'm presenting this work on behalf of myself and Dr. Joshua R. Smith. So as a background, there's been a lot of research performed regarding inspiratory muscle training, or IMT, and research has shown that IMT can improve respiratory strength in clinical and athletic populations. It has also been shown to improve exercise performance in athletes as well. Most protocols that exist use a moderate intensity load for their training. And in reflecting on the muscles that are targeted by inspiratory muscle strength training, such as the diaphragm, intercostals, accessory muscles like the scalenes and sternocleidomastoid, these are all skeletal muscles. And ACSM recommends that to achieve muscle hypertrophy, you should be training at intensity levels of 80% of your 1 rep max until task failure. In comparing these ACSM guidelines to current IMT training protocols, there's a mismatch in the intensity of training. And this sort of brought this question up to us was, would higher intensity IMT training be more impactful at improving inspiratory strength compared to the currently used moderate intensity protocols? So the purpose of our study was to compare the effects of high and moderate intensity IMT training to task failure on the inspiratory strength and VO2 max, or aerobic capacity, in healthy adults. For our methods, we had 26 healthy adults who were enrolled in our study. This was a double-blinded randomized controlled trial. As participants consented and were a part of the study, they were randomized into one of two groups. So we had a moderate intensity and a high intensity group. At baseline, both groups completed demographic information and then performed inspiratory muscle strength testing through S-Index, which is like a dynamic measure of inspiratory strength, and is comparable to maximal inspiratory pressure. They also completed aerobic capacity testing, and then once that baseline testing was complete, they were given an inspiratory muscle training device. So this is the device that we used. This is the Power Breathe brand, but there's a lot of different tools out there. So they were given the device, they were trained on how to use it, and then given identical protocols. So the protocol consisted of use 5 times per week for 8 weeks, doing 40 reps or until task failure. And the independent variable between groups was the resistance load. So the moderate intensity group had a resistance set at 50% of their 1 rep max, or their baseline S-index, while the high intensity group trained at 80% of their 1 rep max, or their S-index at baseline. At the end of the 8 weeks, blinded outcomes assessors measured again participant S-index and aerobic capacity, and then the trial was complete. For statistical analysis, we completed repeated measures ANOVA to look for differences from pre to post training, as well as for interactions between group and over time. So what did we find? We were a little surprised by the results overall, but an important finding was that both the moderate and high intensity group did demonstrate significant improvements in inspiratory strength. What was interesting, however, was that there was no significant group or interaction effect, meaning there wasn't a group that was superior to the other. So both moderate and high intensity IMT resulted in similar improvements in inspiratory strength, and there was not one training load that worked better than the other. There were no significant main effects at all for group time or interaction for aerobic capacity, so that didn't change for either group. So with these results, some interesting takeaways. Training at higher intensity is going to be harder because your load is much heavier. So we can recommend now that a moderate intensity, 50% range of intensity, can be just as effective as higher intensity and is more comfortable to complete, so maybe more successful for your patients. We would also recommend that Future research into IMT would continue to explore specificity of training as we really start to hone our ability to individualize treatment to our patients. Thank you for your time.